Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracedo is interpreting the press conference in Spanish, and his interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. Understanding the complexities of the COVID-19 pandemic crisis is not easy. There are so many conflicting stories circulating, it's very hard to know what is true. All of us are left with nagging questions. Are antibody tests accurate? Why can't we get enough swabs? Will there be a second wave of infections? One of the reasons all of this is so difficult to sort out is because COVID-19 is a new virus. It only began infecting humans late last year. Since there's no historical track record to rely upon, many of the early answers to questions were best guesses from the available information at the time. Scientists are working feverishly around the world to understand the virus, but it takes time to build solid scientific answers to complex problems. The scientific method relies on testing and retesting hypotheses with controlled experiments using randomized samples. The faster the process, the less reliable the results. Decision makers need scientific answers quickly to inform public health decisions, but we also need the scientific information to be accurate. Scientists are members of a rare, objective professional breed that evolves their recommendations as more data is gathered through research. New evidence is welcome to advance scientific understanding. Serious decisions have been made with the best information available at the time because the health threat demanded an immediate response. The only way to move forward was to use the best information that was available at the time. As time has gone on, more precise scientific information has become available about the virus that led to new decisions that are better informed. As a county, we've worked to clarify information on a timely basis through these press conferences and updates to our COVID-19 website. This is a critical forum to get accurate information to everyone in the community, both in English and Spanish. We're all working together to ensure our local community has the information you need about the services available and how to get help. If scientists, public health officials, journalists, and elected officials are consistently clear about the uncertainties inherent in this changing scientific emergency, the public can better understand when shifting evidence leads to and requires new policy. Policy updates and new information can feel very confusing. When policy changes quickly, it can seem like an arbitrary flip-flop. That's not a good way to communicate. It contributes to diminishing trust in organizations and government. When people don't have a place they can go for trusted information, it makes us vulnerable to disinformation. My elected official colleagues around the county are getting huge numbers of phone calls and emails from constituents who want us to open businesses faster. Other constituents are very concerned that we're planning to open businesses too quickly and will put our community and public health at risk. There have been a number of news stories in local media this past week that left the impression that the County of Santa Barbara can allow cities to reopen businesses more quickly. As I've said many times at these press conferences, county public health officers, county board of supervisors, and city councils may not legally reduce the restrictions of the governor's stay-at-home order. Local governments can increase restrictions, which many local governments have done, but they may not reduce or lower the public health closures mandated by the governor. There is also apparently confusion about how the county's regional business reopening planning effort and each city's own reopening planning efforts work together under the governor's strategy for reopening businesses in California. This subject is understandably very confusing because, like the science involved in COVID-19, the business reopening strategy has changed because it had to. Originally, Governor Newsom indicated counties would have a significant role to play in determining the pace and scope of local business reopening, based on local conditions. In response to the governor's indicated direction, Santa Barbara County immediately convened a business reopening and recovery stakeholder process and planning group. This group includes elected and staff representation from each of the incorporated cities in the county, along with business leaders across a broad spectrum of local industries. The original task of this group was to make sure we were ready to move forward when the governor granted reopening authority to our county. Unfortunately, when Governor Newsom announced last week the criteria counties must meet to move faster on the path to reopening local business, it was very different than what he had originally implied. The new criteria cannot be met here in our county and across the vast majority of the state unless it is modified. Yesterday, the Board of Supervisors unanimously approved a letter to Governor Newsom requesting modification of his new criteria. The board's alternative proposed criteria both protects public health and creates a reasonable path for reopening local businesses. Our state legislators, Senator Jackson and State Assembly members Lamone and Cunningham, are all lobbying the governor on our behalf. Each of our state legislators are specifically pressing the governor to consider the COVID-19 outbreak at the Lompoc Prison as a unique problem that requires a unique solution. Santa Barbara County cannot be held responsible for the coronavirus outbreak among incarcerated prisons because we have no authority over prison operations. If this issue and the others the Board of Supervisors raised in our letter to Governor Newsom are successfully resolved, we will still need to attest that we are meeting all the state criteria required to reopen local businesses. All of the cities in the county have been asked to send information to the County Department of Public Health to include in our county's submission to the state of California describing how each jurisdiction proposes to locally address the state public health criteria the governor has identified. The valuable and diligent and comprehensive work of the county's regional business reopening stakeholder group will also be included in our submission to the state. We do not know when or if the governor will modify his criteria to provide our county a path forward to reopening more businesses. We are working collaboratively with our local government partners to be ready if the governor creates that opportunity. Yesterday, Governor Newsom modified his statewide stay-at-home order to allow another limited set of businesses to reopen across California, including offices where teleworking isn't possible, outdoor museums, and limited personal services, such as car washes, pet grooming, and landscaping. These businesses must all adhere to the state operational regulations to prevent the spread of COVID-19. Governor Newsom also said he could have new information to report as soon as next week regarding reopening more businesses statewide. This is the most up-to-date information we have at this time. Please don't be surprised if the information changes, because the only thing we can count on in this extraordinary time is uncertainty. This is the new reality, and we must all be adaptable to the change this moment requires. Today, I'd like to recognize the fantastic work of Santa Barbara County Food Rescue, a collaborative effort led by the Community Environmental Council. This group formed in 2018 to prevent greenhouse gas emissions from food waste, partners with local restaurants to ensure that excess food goes to those in need rather than to our landfills. In response to COVID-19, SBC Food Rescue is helping feed vulnerable community members while also supporting our local chefs and restaurateurs. With many restaurants eager to step up and community organizations ready to answer the call for service, SBC Food Rescue is helping connect prepared meals to service providers. This partnership between the environmental community, food service providers, and local businesses is the perfect example of the unprecedented collaboration and innovation that is taking place in response to this pandemic. To expand this important work, SBC Food Rescue is asking for community support. The Community Environmental Council has received generous support to match all financial contributions between now and June 30th. To learn more about how you can help, please visit sbcfoodrescue.org. Next, I'd like to introduce Dr. Henning Anzorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. As has been requested by many community members as well as our local journalists, we are now reporting community cases in the county separate from the Lompoc prison cases. We have a total of 1,376 cases in the county, with 894 of them in the prison and 482 in the community. Of the 482 community cases, 26 people are hospitalized, with 10 in the intensive care unit. 394 have fully recovered. Of the 894 cases at the prison, 719 cases are considered still active, with approximate 95 cases considered fully recovered. Our hospitalization level and ICU care need has remained steady, and all of our hospitals are still operating below their capacity and have very robust ability to surge in case of a need for that. Again, I want to emphasize that this stability is a direct result of our community's ability to keep new infections at a lower level. This can only be achieved through diligent physical distancing, wearing of face coverings where important, postponing gatherings with people that do not live in your home, and excellent general hygiene measures. I also continue to encourage community members to get screened and make an appointment for testing. You can go online to lhi.care/COVID testing or call 1-888-634-1123 to make an appointment. Additionally, if you need some assistance in making your testing appointment, call the Santa Barbara County Call Center for help in English and in Spanish. The number for that is 1-833-688-5551. This testing option is available to all community members, and we have been pleased to see full schedules in Santa Barbara and Santa Maria. In Lompoc, the Lompoc site consistently has availability, so I encourage residents in the area to get an appointment for testing there. The soft opening of some business aspects last Friday is very closely monitored by our statistics experts, and so far we have not seen any indication that we need to be concerned about a new rise in cases. However, it is still very early in this opening phase. Just earlier this afternoon, I had a very constructive conversation with our state health officials about the seemingly strict requirements for being allowed to open at a faster pace. The state reassured me that these requirements were never intended to be a permanent measure and that the plan for these to get adjusted as soon as safely possible. The metrics in particular that we haven't been able to meet are not having any deaths from COVID and a very low number of new cases, namely less than 45 cases during a 2-week period. Once the data show that the soft opening that started last Friday did not cause a spike in new cases, I am certain that we will be able to proceed further in our reopening plan. In the meantime, the county CEO's office, together with the Public Health Department, has partnered with a group of professionals as well as an expert team comprised of local infection and lab medical specialists to delineate a detailed plan for our local industries and various business sectors, to produce a concrete guide on how best to modify and prepare for the stepwise and safe reopening. We are very pleased that this report will be published very soon. The Public Health Department is constantly updating new information on our website, available in English and Spanish. It is at www.publichealthsbc.org. We have all come a long way since the beginning of this pandemic, and through our intervention measures have averted a large death toll and subsequent a collapse of our healthcare system. We are now slowly entering the reopening phase, and I encourage everyone to stay the course and be patient for a little bit longer until this reopening can accelerate in a way that keeps our workers, our customers, and residents safe. Thank you.
Thank you, Dr. Ansberg. I also invited Wendy Sims-Moten, the Executive Director of First Five Santa Barbara County, to share the work she and her team are doing to protect and support the hundreds of early childhood educators in our county. Child care workers are on the front lines, selflessly and tirelessly providing consistency, safety, and nurture to the children of essential workers. Many are expanding their hours in the evenings and weekends to ensure that our healthcare system continues to operate, grocery stores and gas stations remain open, and our first responders are available. Childcare has been and continues to be the backbone of our economy, allowing parents to work and society to keep functioning. Thank you, Wendy, for being here today to share the critical work of First Five.
Thank you, Supervisor Hart. It's a pleasure to be here to share the work First Five is doing with regards to our community members as well as individuals and our child care workers. First Five Santa Barbara County and Families, Children and Families Commission is funded by Proposition 10. It works in partnership with county departments, individuals, organizations throughout the county to support the health, early learning, and well-being of children prenatal to age 5 and their families. For more information, I encourage you to go to our website at first5sbc.org. During this unprecedented time in our history, much of our attention has been on how to support our local essential workers to assess reliable, safe child care so that they can assume their critical duties in helping society maintain. In partnership with Santa Barbara County Education Office and Children's Resource and Referral, First Five Santa Barbara has contributed to the analysis of need, planning, and implementation of child care options that meet the CDC requirements for health and safety that help to link employers and individuals seeking child care options to appropriate providers throughout the county. To maintain health and safety requirements, additional supplies have been procured to be distributed to child care providers serving essential workers so that they can enhance their cleaning efforts. On April 13th, First Five California Commission held an emergency meeting authorizing $4 million in funding to support the acquisition and distribution of county-identified essential supplies for babies and young children, in addition to much-needed sanitation items. Camille Mabin, Executive Director of First Five California, worked with representatives from the Governor's Office and Administration, local First Five County Commissions, First Five Association, and child care advocates to identify the most needed supplies, along with strategies to obtain them. This includes 60 days of mission-critical supplies from the supplybank.org. First Five Santa Barbara is partnering with Children's Resource and Referral to distribute essential supplies and are awaiting the arrival of their first shipment, which will include 3-ply masks and gallons of disinfectant. The second larger shipment of 17 pallets is scheduled for the end of this month. It will include diapers, wipes, and more cleaning supplies. The second shipment will continue to prioritize for child care and would also now include, as I get my notes here together, distribution to the public. Children's Resource and Referral will be working with First Five funded agencies such as the Network of Family Resource Centers and Welcome Every Baby to distribute these supplies to families across Santa Barbara County. Many families, especially those of essential workers, are experiencing heightened levels of stress due to COVID-19 that can impact their children. In efforts to mitigate some of those stressors, talking, reading, and singing to young children can help buffer the negative impacts of stress, which is important for keeping children healthy. So, in addition to cleaning supplies and other essential materials, First Five California is shipping over 700 children's books for distribution to children's site to be handed out to families of essential workers. The first supply distribution is scheduled for Saturday, May 16th from 8 a.m. to 12 p.m. at Santa Maria Children and Resource Referral at 124 West Carmen Lane, Santa Maria, and 2 p.m. to 5 p.m. at Santa Barbara Resource and Referral location at 4141 State Street. There will be a contact-free drop made into the trunks of vehicles. Child care providers who are interested in getting supplies should contact Children's and Resource and Referral at 805-925-7071. And finally, First Five would like to extend our appreciation to the many early learning and care sites and their staff who are tirelessly working every day to ensure healthy, safe, and nurturing environments for our children and families of essential workers. ECE professionals are one of the front lines, adapting, adjusting, and being extra vigilant following new guidelines for sanitation and social distancing, while also facing increased risk of exposure themselves. We are appreciative of First Five California investments and of the partnerships with Children Resource and Referral to get these much-needed supplies to our child care essential workers so they can continue to safely serve families across our county. And remember that our children are listening, they're seeing us, and they're hearing us. So it's really important that we're listening to them and that we see them and that we hear them as well. Thank you.
Thank you, Wendy. As the former owner-operator of a child care center, I know firsthand how important high-quality, affordable child care is to our children and their working parents and our local economy. So thank you very much for all the work you're doing at First Five.
Thank you.
We'll now go to questions from the room. Ms. Lair?
I'd like to start with First Five. Is there a plus side to all the parents at home right now?
I think it is. I think, the fact that they're able to spend more time with their children at a time when you're working, two parents are working, and you don't often get to spend that dedicated time. So it certainly is a plus side to that. And also appreciation of when kids are at school that, wow, got 30 kids they have to deal with. So they certainly appreciate the time that they're able to spend with their kids, a lot more of that than if we were at a normal time of two parents working and outside the home.
And Dr. Ansor, there was a flyover going towards hospitals that we believe have COVID-19 patients in them. Could you describe, since we have such a steady number of people in ICUs and hospitals, what hospitals those would be, where those patients are, and if it does seem like you're meeting that requirement, if you could clarify what the county has to do. It seems like you have flying colors, no pun intended, on the hospitalizations.
Yeah, we have a very steady ICU census. That's the term of, same amount of patients in the ICU, so some recover and are able to get out of the intensive care unit, and new ones get sick and come in. We have Marion Hospital in Santa Maria. We have Lompoc Valley Medical Center in Lompoc, and Santa Barbara Cottage Hospital, obviously here in Santa Barbara, all with intensive care units. And they're all, to my knowledge, taking care of COVID patients in the intensive care unit. Not exclusively, but they have also COVID patients in the intensive care unit. The flyover, I only heard here in the county building, so I wasn't aware of that maneuver, but I'm glad for the recognition, because those hospitals certainly deserve that.
Thank you. Are there any other questions in the room? Next, we'll go to calls on the phone.
Yes, first up we have Laura Place, Santa Maria Times. Go ahead.
Thank you. My question was for Greg Hart. I was wondering if you could clarify just what some of the misrepresentation was that you referred to at the start of the conference, just in regards to reopening, just so we can keep that straight. I was just looking for a little more clarification on that.
Well, I didn't use the word misrepresentation. I think what there is confusion because the circumstances have changed. The original intention of the governor was apparently to give local governments and counties specifically more authority in the process of reopening businesses. For whatever reason, probably because of state data on the COVID crisis, that direction was changed and became more specific and created criteria that were very difficult to meet. We have expressed, as I mentioned earlier, through a letter to the governor, our interest in modifying some of those criteria to make it more reasonable for counties like ours to meet. And as Dr. Ansor described, that process is ongoing, and we're working with the county or the California Department of Public Health to modify those restrictions. And the governor is at the same time opening more businesses. So this is a very dynamic situation. That was really the intent of my remarks, is to point to the fact that circumstances are changing, policies are changing to adapt to those changing circumstances. And this is a very dynamic process, and will probably continue that way as we go forward.
Now, I understand that. Apologies, I must have misstated my question. I meant in regards to what some media outlets had shared. You said that there was some untrue information shared by them regarding, when cities in the county can open. I was just wondering what the information that was incorrect that was shared, just so we can make sure to keep that straight moving forward.
I didn't use any of those words, didn't say that, and don't think I need to clarify my remarks.
Okay, I mean, I think you had said that, the media had contributed to sharing some incorrect information just about when cities were reopening. I don't think I'm remembering that incorrectly, but so you don't want to respond to that then?
I want to make, what I said was that the circumstances have changed, and everyone is working collaboratively to work with those changed circumstances to move forward, given the governor's guidance and given the fact that the governor has not created a path that we have available locally to reopen businesses faster than his direction. And I want to make that really clear. If there's some confusion, amongst members of the public, because we have been getting lots of phone calls and questions from constituents who want us to reopen faster, others who don't want us to open as fast. And the point of my remarks is to clarify that the governor's stay-at-home order applies to all the residents of the state of California, except those counties that have been able to meet his criteria, very small population rural counties in Northern California, almost exclusively, and that the path that we thought we'd be able to take has not become open to us, but we are continuing to work to make that happen. So that if there is confusion at the local government level, if there's confusion in the public, we want to make this very, very clear.
Okay, thank you.
Thank you.
Next up, Tom Bolton with Newshawk. Go ahead.
Just a quick question for Dr. Ansorg. If I got your number correctly, it sounds like there were 5 new COVID cases that you were reporting. And I'm wondering if you can tell us how many of those were community cases versus prison cases.
Oh, none of them were prison cases, to my knowledge.
Okay, so there were no new prison cases, just 5 community cases.
I recall there were 2 new prison cases.
So 3 and 2.
We have a cutoff when we get the numbers through our official channels, and sometimes I peek behind the curtain right before the press conference, and I get a little confused so please excuse me. But the official number that I recall was 7 in the community and 2 in the prison. Please take that with a grain of salt, please.
Okay, yeah, because yesterday you were reporting 1,371 cases, and today you said it was 1,376 cases, so that would be 5.
I do recall that some had to be taken off the roster because they were incorrectly identified. So there was definitely a change in the numbers, which
So we can
adds
assume
to the
that'll be
confusion,
updated.
unfortunately.
We can assume that'll be updated in your press release this afternoon?
Yes, I would think so. I think those ladies are much better with numbers than me.
Okay, thank you very much.
Those are all the questions we have.
Every press conference, I repeat the 3 simple steps each of us must continue to focus on every day, because I am reminded that not everyone is getting the message, unfortunately. We are all in this together, and we must all keep up our work together to protect each other. Please don't slack off on the 3 important daily measures that are now the foundation of our lives and have worked to reduce the spread of the virus. Number 1, please stay home as much as possible when you're not shopping at local businesses. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands often and at least for 20 seconds. Don't touch your face and disinfect surfaces regularly. Number 3, if you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be held Friday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Thank you for joining us today. Please be safe.